Yes.
Anita, ma'am.
Yes, ma'am. Good morning, everyone. We would like to wholeheartedly welcome each one of you on behalf of the Deccan Positive Mental Health team for a session on cognitive behavior therapy. And our speaker for today is Dr. Suresh Kumar Murugesan, sir. And sir, Dr. Suresh Kumar Murugesan sir is a passionate professor, researcher, and a positive mental health practitioner from Madurai, Tamil Nadu, India. At present, he's heading the PG Department of Psychology, the American College, Madurai, Tamil Nadu, India, and an adjunct professor, School of Behavioral Sciences, Texila American University. He's a very keen person in research studies and open to learning. His ultimate aim is to make impression in the field of knowledge. His areas of specialization are psychometry, positive psychotherapy. He has published 30 journal articles, 50 conference and seminar proceedings. He's organized more than 1,000 webinars and acted as a resource person for over 500 plus webinar sessions. Sir has also received 8 awards and delivered 25 plus radio talks. Qualified UGC NET in psychology and education. Sir has also completed a central teachers eligibility test. He has published 3 books. So a very warm welcome to you, sir. And the floor is yours. Over to you, sir. Thank you so much once again.
Thank you, Anita ma'am, for that wonderful introduction and welcome.
Thank you, sir.
Before getting into the session, I would like to dedicate this workshop, I can say, online training program on CBT to Dinagar Rao, sir, because he had a faith on me, and I hope I will fulfill his faith. And I also thank Sunanda, the president of Deccan Positive Mental Health. We planned these things in person many times, but we couldn't make it. But we are here to make it in online mode. So I'm going to let you know the basic information regarding CBT and why it is important and what we are going to make it in this presentation. Cognitive behavior therapy is an widely used therapy in practice as of now. There is no substitute. In clinical psychotherapy, counseling, we can go anywhere else. CBT is on nearly 80 plus therapists are practicing it. One thing. And second one is CBT, it is not a single therapeutic component. It has many subtypes. We believe that it is an only one. There are many subtypes are there in CBT itself. The brief cognitive behavior therapy, rational emotive behavior therapy, cognitive therapy. There are many components are there. I will give on some insights on that in the beginning. The second part of my session is regarding, we are going to make it understand that the common mental health problem, when we take it in a survey, neurosis, that are called neurosis, anxiety, stress, fear, phobia, depression. So these are the very common problem you can able to see. I'm going to guide you, or I'm going to help you how to prepare a worksheet. You can do yourself, because we had our anxiety, we had a neurosis problem in our lifetime. And you can take your past or present one, and you can use these worksheets, and that will help you how to work. When we do these things for ourselves, and I used to say that when we are succeeded, we can able to help the members, the client who are coming to our center also. Third part is very important, what we can say, the brain of CBT. CBT, it's very simple. Its main focus is that to identify that automatic negative thoughts and ANT. There are many researches they were carried out, and nearly around the world they have made an attempt. They come up with different cultures. A certain automatic negative thoughts are common to irrespective culture, and how we can convert that automatic negative into automatic positive thoughts. So these are the three components we are going to discuss. And CBT is an ocean. Within 1.5 hours, we cannot able to cover everything. So that we must keep in our mind, within 1.5 hours, we can able to make an attempt. So I'm giving the line. So you have to make a road. I'm giving the line and you have to make a road. And the basic ingredients will be given to you. The steps involved in CBT and how you can use these the worksheets for different problems. When we are giving that for anxiety, That could be used for fear, that could be used for anxiety, that could be used for depression also. So common platform will be given. I take the first 30 minutes for 30 to 40 minutes for understanding the concept CBT. Give me a minute to share my screen with you all. Okay. Yeah. I hope my screen is visible to you all.
Yes, sir.
Okay. So why we need to understand basic things? I think cognitive behavior therapy, it has three important terms: cognition, behavior, and therapy. We'll start from therapy itself. Therapy, generally, when we understand that the meaning, a treatment for the illness or disease. Okay, we cannot exclude or we cannot include only particular illness. All the illness, maybe physical, mental, emotional, all the illness, when we are giving a treatment, that process is called therapy. But actually, in generally, the therapy is more commonly used in mental health rather than physical health. More commonly used in mental health component. And even some traditional practices like granny therapy, you may hear the term. Granny therapy, the words are used. And when we come to the behavior, there are two types of behaviors. First, we will understand what is behavior. Behavior is on any kind of actions we express. It may be the way of we are presenting, the way of we are walking, and these components are called behavior. And these behavior we can categorize into two: appropriate behavior and inappropriate behavior. That inappropriate behavior we can say deviant behavior. The ultimate aim of behavior therapy is to correct the deviant or abnormal behavior. That's all. So what a therapist will do in behavior therapy, they will give a psychoeducation to the client that the behavior you are exhibiting is deviant or inappropriate, or it may be not socially accepted. So they will bring it to the notice and they will give a role model to them. They will give a training, hands-on training, how you can express your appropriate behavior. So that will be done in the behavioral components. We'll move on to that cognitive. Cognition is nothing but higher order ability of an individual. Our thinking, our problem solving, our memory, our decision making, reasoning, language, and everything that comes under cognition. And these cognitive components, majorly we are as of now focusing on only on that negative thinking or waste thoughts, waste thinking. So these are the components of problem are mostly addressed by the practitioners. But it includes memory problem, it includes learning problem, it includes the person who are not able to make a right decision also. But as of now, we are giving much importance to only on negative thoughts or a thought that gives unpleasant experience to the person. And cognitive therapy, it's not about cognitive behavior therapy. Cognitive therapy, they are focusing on that, how to control, how to manage that negative thoughts. And cognitive behavior therapy is a blended therapy. You have to understand that. Blended means when we use the two languages, a new language will emerge. When we use two languages, new languages will emerge. The same way, when we use two different materials, a new metals will emerge. The same way here, the cognitive therapy, behavior therapy are blended, and there is a new therapy is emerged. That's why I said, no one can say that dedicatedly on a behavior therapy. We will use cognitive component also. I will let you know when we are. I hope you are aware about that. The history of psychology. The main focus is about the conscious, unconscious mind. As we are aware about it, that is the way we started exploring that human mind. What we can call as in psychoanalysis or psychodynamics. And later on, after them, there is one field that huge success. I can say that the behavior therapy, the behaviorist. Because behaviorists who believe that everything we can give a evidence, the concrete evidences. That's why when you look at the emergence of psychology, and the emergence of therapy, behaviorists ruled a lot of time. So when we take on India, most of the time India was ruled by a particular king. So we can say in the same way in psychology also, behaviorists ruled the psychologists most of the period because they are able to give a more concrete evidences. I can give one example: behavior modification. When they say that sometime when we go to circus, we can able to see elephant will ride a bicycle. We wonder how it can be possible, because they made it more systematically. It could be done. Anything could be done by training. And when these things were very popular, a group of researchers who come and said that in a behavior therapy, there is a stimulus, there is a response. The stimulus may be positive, the stimulus may be negative. The response may be positive or negative or neutral. So these are process. And a group of people who come and said that what is happening in between stimulus and response? We are processing that stimulus. We are responding, the process. That's why stimulus, processing and response, the cognitive therapy emerged. Cognitive psychology emerged. And they focus on more on the process component. There are few schools also that focus on cognitive component. One is Gestalt. Gestalt also focusing on cognitive. They look into holistic, they never look into that bit and pieces. And another one is cognitive perspective. They look into that mostly on what kind of process we are making. They given one more thing. I think it could be relatable for us. If two persons are there in a place, one person feel more comfortable, another person maybe or may not be. Why? The environment is the same, the stimulus is the same, but why people are having two different kind of experiences? And that is the interesting point. They said that it is not about that environment we are having, it is about how we are perceiving that information, how we are processing it in our mind. That determines everything. Where like CBT, cognitive therapy, is very booming, and there is no substitute as of now. And if you ask me that, there are the practitioners who are in the field, they may say that when compared to CBT, humanistic therapy is commonly used. I do agree with that. But humanistic has many components of CBT only. In CBT, mostly the therapist play a dominant role, because they will give on guidelines to them, do these things. But in humanistic therapy, they just facilitate us. Other components are the same. The role of the therapist are different in cognitive therapy and humanistic therapy. In humanistic therapy, they just facilitate that, and all the decisions will be taken by the client. Because humanistic therapy, they believe that they have the potential to solve their own problem. Only thing is we need to facilitate. But CBT is, on the other hand, when there is a problem, we are not give more stress to the client. We, the people who are aware about it, we have to give a suggestion to them, and they have to take care of it. So that is the basic difference. And I hope this intro is give some insights to you all. And I will move on to that the next one. So these points we were discussed. Here is the one we can understand. We can focus that. There are in therapy itself, there are many common approaches are there. Humanistic approach, psychodynamic approach, behavior and cognitive approach. And in these approaches, they given a therapies. The therapy is called, in humanistic approach, there are two therapies also. One is person-centered therapy, another one is existential therapy. Person-centered therapy focus on that. The client is very important. They have to make all the decisions. Existential is more philosophical. It is a combination of philosophy, spirituality, and believing on that the person having the potential. Like idealism. I hope those who are studied in philosophy, there are many philosophies there. Idealism, naturalism, pragmatism, existentialism. So in existentialism includes idealism also. We'll come to that next one. In the psychodynamic approach, there are two components. When you look at here, psychoanalytical and another one is Adlerian. Adlerian has a huge contribution. I used to say that a structured interview pattern and everything is given by him only when the client comes for a counseling. He is the first person who made an attempt, but when we go through the questions he has prepared and need to be modified at the present context, because when I go through that, I found that certain components are not relevant up to the mark. But he is the person who made a roadmap for the mini mental state of the examination. We are calling it now, when the client comes, we have to collect the detail from the client, mental state of the examination. So that could be done by Adler only. And psychoanalytical, there are many people who contributed. And these psychodynamic approach believe that everything is your conscious and unconscious mind. So when you are making an alter in your conscious and unconscious mind, they never use the term called cognition. When you make alter, when you are making train these components, we can able to help the person to solve the psychological problem. And the next one is behavioral approach. In behavioral approach, there are two theories: behavior therapy and behavior applied behavior analysis or behavior modification. And please understand that the second one, applied behavior analysis or behavior modification, are generally used in special education, special kids, autism, intellectual disabled, and disabled people. These components were most commonly used. It doesn't mean that it cannot be used in general population. It can be used in general population also, but mostly it is used for special population. And when we look at that cognitive approach, there are two components. One is Aaron Beck and another one is Albert Ellis. Aaron Beck and Albert Ellis, they made an amazing effort. Aaron Beck, he said that everything is cognizant. When you make change in your cognition, you can change the person's everything. Just altering that. Instead of I cannot, I can. So that is a way. So that is the way he used to say that. Rationalism, they, instead of not only cognition, emotionally we have to prepare ourselves. We must feel that it will work for that. So that is an emotional component. But mostly these two are aligned with that, complement each other. So here we will know on that integrated therapies. So when we combine these therapies, only humanistic and psychodynamic, there are two therapies are emerged, what we can call as an integrated therapy or blended therapies. Gestalt therapy and transaction analysis. You all very aware, Eric Bohn's transaction analysis and Putzpohl's gestalt therapy. Generally, people who have a misunderstanding that Gestalt theory is different from Gestalt therapy. Gestalt theory is proposed by Max Wertheimer, Kafka, Kohler, and many people. But Gestalt therapy, the theories are already made someone else. They took the theory and they are made an attempt to apply it into the practice. So Gestalt therapy. And rational MOD behavior therapy is a combination of these two. Rational means cognition, emotion, and they are combining in the behavior also. REBT, very popular, and CBT, combination of these two. So this we call as an integrated therapy or blended therapies. And the next one is eclectic approach. The present day, the most effective method is called the eclectic therapies. Why? They found that the important component from all these approaches are taking care and they are utilizing it. And there are two components. One is multimodal therapy, another one is neuro-linguistic program. Okay. So here are the founders of CBT and Aaron Beck and Albert Ellis only. And they are the founders. What is CBT? See, CBT that give treatment for how we feel, how we think, how we behave. The interaction in these three, if it is on normal, we won't give CBT. If the interaction with these components, we feel that uncomfortable, then we can go for CBT. And as we have said that it is one of the talking cure or talking therapy. So what it will do, what it will be done in the CBT. See, how we think about ourselves. Generally, we can able to understand that what kind of thinking we are having about ourselves. Members over here, I can say, close your eyes. Please close your eyes and ask about yourself. Tell me about me. What do you think about me? Your mind will tell you. You will hear an inner voice. And if it is an appreciating, if it is a neutral, there is no problem. And if it is saying that you are waste, you are not good for nothing, and these kind of words we are hearing about yourself, that need to be altered. That need to be altered. I think as per the spirituality, as per the science, no one is bad. Everyone is good. But who is bad? The people who are having the inner voice, the mind. I hope the people who know the Kamal Haasan movie, Ala Vandan. So that in that movie, there are two Kamal Haasans will be there, brothers. So one person dominated by devil force, another person by angel. So good personality will dominate. So when you ask about yourself, if it is saying about yourself is in positive manner, you are in good condition. You need not to change anything. But if you hear something wrong,
Voice is breaking, Dr. Suresh.
yes, sir. 1 minute, I'll try there. Maybe internet fluctuations will be there. Is it okay, sir, right now?
Please.
Yeah, okay. Thank you. And second part is about CBT that focus about how our thinking affect our behavior and feelings. When we think that thinking has nothing. There is a saying that what you think that you will become. What you think that you will become. When you think someone is good, you feel good. You behave appropriately. When you think that someone is not good, our behavior is totally different in that occasions. You can imagine that many occasions, there are many studies were also done on that. So when someone is, even most of the people are saying that the person is not good, but when you believe, when you think that that person is good, your behavior will be appropriate to the particular person. Okay, so this is about CBT, and I'm going to just give a brief intro about the history of CBT. Am I with you all?
Yes, sir.
Yeah,
Yes, sir.
Thank you. And if you are overloaded information, please stop me. We will have an activity also. So in the history, it started in 1960s only. As I said, 1990s only the psychology field, the therapy field are emerged. What we can call as a psychodynamic or psychoanalytical therapy. They are the one who ruled that time. Then behavior therapists come 1920s, 1940s. And up to 2000 only, they are still ruling only. 1960, the new concept emerged. And by Aaron Buck, he is a psychiatrist. Basically, he is a psychiatrist. He found that some thoughts, a type of thinking that has impact on our emotions, that create a lot of emotional problem in an individual. That is the point he found that the client were coming for his center, and he thought that, okay, if a person having a particular thought, that thought has a huge impact on their behavior and feeling. And he believed that also each terms, the thoughts, feelings, and behavior are interconnected. And in which among the feeling, behavior, and thought, he believed that thought has a huge impact on our feeling and behavior. Okay. And there is an ANS, actually ANT, I have to put instead of I typed wrongly. And Beck labeled the problem called automatic negative thoughts. In the beginning itself, I said, it is very important to the counselors, the therapist. We have to identify that automatic negative thoughts. Automatic negative thoughts, nothing but when we are interacting with someone else, when we are conversing with someone else, what kind of words more frequently we are using, or else when you are alone, when you think about something, what kind of thinking we are getting, that we can say that automatic negative thought. I can give one example.
Again, voice is breaking, doctor.
Sir, what about other members, sir?
No, sir, it is clear for me.
Sir, my internet
It's
is
clear, sir. It's clear.
okay, sir. So automatic negative thoughts are very, very prominent problem for the people. When we are having automatic negative thoughts, it's our duty to find out and accept that we are having automatic negative thoughts. The members over here, I'm going to give an example. If I say a name, what comes in your mind? You have to tell me. There are two persons I'm going to tell you. Okay. One is Hitler. Can anyone please unmute and please let me know what comes in your mind?
A cruel dictator, sir.
Amazing, ma'am. Okay.
What one person can do against mass of so many people.
Okay.
Megalomaniac.
He want to conquer the world.
Lovely, 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 sir. Any other?
Very strict.
Very
The rules, other thing. I think as
Lovely.
we come to. As
Amazing.
we refer Hitler, if somebody is very strict with us, we refer that you're behaving like a Hitler.
Okay, very good, very good. So I'm going to tell you one more person. Anna Teresa, Mother Teresa. What comes in your mind?
Kindness.
Kindness,
Peace.
For
peace.
me, same, sir. What one person can do
Yes.
against a
Okay.
large number of people.
Amazing,
She is
amazing,
a pious lady, sir.
amazing. Good, sir. Any other?
Humanity.
Lovely, ma'am. See, when I say a person, that is called automatic thoughts. What you have in your mind, you are not prepared anything. Am I right? You have not taken anything notes and you have not prepared. These thoughts are positive, it is unaccepted. Think about your family member. I'm going to give one more exercise. Think about any one of your family members. When you think about that person, if you are having neutral or positive thought, there is no problem at all. If you are thinking about someone in your family, the negative thoughts are automatically come, and that will lead a lot of problem in later stages. It is our duty. We have to alter, we have to correct it right now itself. Yeah, think about any one of your family members. And if you are having positive thinking or neutral thought about them, there is no problem in your relationship. Easily we can identify. So that is the way when a client comes to our counseling center, we have to ask, okay, if you think about your son, what are the components that comes in your mind? You think about your husband, you think about your wife, what comes in your mind? You have to ask them. And if the thoughts are automatically positive, I think your relationship will be good. You need not to make on any effort, but if it is a negative, definitely we need to come forward and make an effort to change it. Okay. So I'll go back to the presentation. I'll quickly run through that. Okay. Another one is behavior therapy and CBT, cognitive behavior therapy. When we look at these therapy, they mainly focus on certain components like association, reinforcement, punishment for modification of behavior, and make a change in that thoughts and feeling, and how these thoughts and feeling affect on that. These are the primary focus of behavior therapy and cognitive behavior therapy. As I said in the beginning itself, when there is a treatment for mental health problem comes in our practice, the first thing that any disorder or disease, CBT is a priority. That is the thing mostly people will rely on that. And most researched therapy, if you ask me that evidence-based therapy, you cannot find much evidence for psychodynamic, you cannot find much evidence for gestalt therapy or any other therapy. But for CBT, you can able to have lots and lots of evidences. So here are the principles, the basic principles, roadmap for the CBT practitioners. What they have to do, they have to identify the faulty and unhelpful thinking of an individual, the client. The second one is, and they have to, where they learn the particular unhelpful behavior, somewhere they may learn, for example, negative coping mechanism like smoking, drinking, or negative unhelpful behavior, where they learn. So how it is emerged, that pattern also need to be studied. The root cause, nothing but a root cause, and what kind of component they are having, what is the level they are having. And finally, so we have to find out the coping mechanism for the particular problem. How we can able to help the person to come out. I can say that in CBT itself, there are many techniques are there. A particular technique will be most effective and it will work for the person. Another technique, it will not work for the particular person. Same problem, if two different individuals are there, there are many therapeutic techniques. Techniques are different from therapy. cognitive restructuring, mindfulness, behavior modification. So these are the things are a part of CBT techniques, a part of CBT techniques. Therapy is a broader component. There are many techniques are there. A particular technique with the two different person, the same problem, it will work for one person. It may work or may not work for the second person. That's why we have to be open-minded and we have to accept that. And the different cognitive therapies here, you can able to get an insight. REBT, Albert Ellis, Rational Emotive Behavior Therapy. So why they started this therapy? Actually, Albert Ellis not satisfied with the concept given by psychoanalysis. They said that catharsis, conscious, unconscious mind. He is not rely on that. He is not happy with that concept, and he feel that something need to be made an attempt. So he made these things. And Aaron Beck in 1970, the same thing. He was inspired by Albert Ellis. When I was preparing content that, earlier I thought that first emerged is on CBT, cognitive therapy, then rational emotive behavior therapy. That is the thought I had, but actually not so. First is an REBT, second one is CT. So both Aaron Beck and Albert Ellis, they are dissatisfied with that psychoanalysis, and they started their own ideology, and they started their therapy and multimodal approach. So multimodal approach therapy is on Arnold Lazarus. Arnold Lazarus, he believed that eclectic will be more effective. I hope the people who are in the practice, you may know that there are different types of counseling: directive, non-directive, and eclectic. Directive, non-directive, and eclectic. Eclectic is a mixture of both. When the client is not able to make a decision, where the therapist will come and intervene and he will guide the person. And cognitive behavior modification by Donald Beckenbach in 1980s. What they said that when you change the language, you can able to make a lot of things in your life. Positive affirmation, gratitude journaling, positive affirmation for relationship, positive affirmations for things. So these concepts were emerged. When you are making language, you can make change everything. And again, the same period, dialectic behavior therapy. It's a part of CBT only, a kind of CBT. Marsa, Linhan, and colleagues. So what they have done that, see, we people are having, when we are having the problem, we do self-destructive behavior. Even fasting also self-destructive behavior. When you are not taking care of yourself, when you are not taking care of your physical body, mental and emotional body, you are doing self-destructive behaviors. So this dialectic behavior therapy will help them to how we can overcome those self-destructive behavior, cutting their hands, harming the self. So those components, and this one is most effective. And finally, very recently, how many years back? Nearly 10 years back, brief cognitive behavior therapy is very popular by David Rudd, and who made for this brief cognitive therapy is on generally in India, therapy long for 2 to 4 sessions, but actually a therapist will insist that must be 16 sessions, minimum 12, maximum 12, 16. But in India, we cannot able to expect that 16 sessions. So they had for 4 to 5 sessions, the brief cognitive behavior therapy is emerged by David Rudd. The people who are in a military who had a suicidal ideation, suicidal thoughts, and they were treated with brief therapy. And here I would like to stop for a minute. Anyone please unmute yourself and let me know. So what are the points you have taken? So take away from this presentation as of now. Anyone? What kind of insights you had?
Yeah, the first thing, today's session is focus on the ANT, that is
Okay.
automatic negative thoughts.
Lovely, ma'am.
And then how to convert them into positive thoughts. That is actually key thing which it's very interesting. I think I found there is And
Lovely.
one thing which you told me that think about a person, okay? The
Yes.
thought which comes to your mind, the first thought comes to your mind, maybe that is the relationship you can, it's a positive or a negative.
Yes.
That is, these two I felt very interesting. So,
Thank you. Thank you, Jyoti ma'am. Any other persons would like to come forward and let me know?
How automatic
Think-
negative thoughts lead to emotions, thoughts affect emotions, and
Yes.
that will lead to behavior.
Okay.
And if I can't take a decision, I should go for eclectic therapy or something like that.
Okay. Okay. Very good.
So
So
the result of the therapy may vary from person to person. If the
amazing.
therapy works for one and maybe not work for other one.
Yes.
So
Yes.
that's the thing.
It's not a therapy side, it's a technique.
Techniques basically.
Okay. 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 Any other?
I was thinking of
Yes, sir.
what our elders used to say.
Hmm.
If you are upset or angry, count 10.
Hmm.
I mean, broadly leads to thought, process, and feelings, then action. That
Yes.
gap is there between thought and feeling. The
Yeah.
gap our elders used to say, count 10, so that your mind will become calm. I felt very happy.
Okay.
And I'm in a position to link what the elders say and what the psychologists are saying. Good.
Thank you. Thank you, sir. Thank you. So anybody would like to say, you can come forward, I can do that. Or else we can go for a presentation. Okay, and I'll quickly move on to the first theory part. As I said, many problems can be addressed by CBT. Many problems can be addressed by CBT. Commonly, it is used for addictions, anger issues, anxiety. Anxiety, as I said, very commonly is there. Bipolar disorder, depression, eating disorder, panic attack, personality disorders. Understand, personality disorders also can be dealt with CBT most effectively. Phobias and problem with stress, mostly a neurosis. When you look at these components, the neurosis problem can be addressed most effectively with CBT. And CBT has certain steps. The first thing, when client come to your counseling center, you have to identify the troubling situations or the conditions in the person's life. Because a person who are coming to a counseling, we cannot understand the person may have only one problem. There are many problems may be there, but they believe that a particular problem need to be addressed. But when we are looking at the other problems and we can understand that the core problem may be different one. It is what we can say it is a symptom. So it is our duty first identify the troubling situations. What make them more uncomfortable? What make them to think the negatively? What make them to behave deviantly or inappropriately? So the root cause need to be identified. Second one is we must help the person to make the client aware about the thoughts. You are aware about that you are having negative thoughts. There are people who are saying that a particular religious people are not good. When you are having this thought, it is a faulty thought. Not all the religious people, only the people who are belongs to that particular religion, the particular person may be the wrong. So these are the thoughts we have to change. And emotions, the belief, that creates a problem. So we must aware about that, what kind of thoughts, what kind of behavior, what kind of belief system in our life that creates problem. So we have to propose a column to the client. So you identify and they have to aware about it, because unless if I am accept that and these things are creating problem, I will not open up for changing it. I will not open up. I will never come forward to make a modification in it. So next one is identify the negative or inaccurate thinking, what we can call as an cognitive distortion. Cognitive dissonance. There are many dissonances are there. All are nothing, generalization, black and white thoughts. Likewise, there are many cognitive distortions are there, what we can call as a negative thinking. Final step is we have to change. How we have to change that negative into positive one. So that is the steps in CBT. And so I given detail, I'm going to skip here. So here are the phases. When a client who come to our counseling center, we can do that. First to do that assessment. The assessment must contain identifying that cognition. What we can say, I'll show you a model. Okay, I'll do share with you a content, what kind of information we need to collect from our client. So this kind of yeah. So this content will be shared with you shortly, and we can call it on many mental status examination. It will identify the problem in our cognition, emotion, relationship, and behavioral component. You can do check yourself, and you can able to understand with your client also. But short format, there is one more format I'm going to give it to you. It has an behavior, emotion, cognition, and relationship checklist. In the math set, to verify those components, there is another component with that. So these detail will be shared with you in another few minutes, and you can check yourself. Not for you cannot go for anybody. You can check yourself, and if you have most of the ticks are there, and you can understand that the particular domain you need to think about it, and you need to alter your problem. And second one is reconceptualization. Once you are assessing, and you know that we believe that the problem in somewhere else. Actually, when you are assessment, after assessment, we come to know the problem in some other part. Develop the skills to overcome the problem. Get a training, generalize, give the post-treatment and follow-up. So these are the phases of CBT. I'll move on to the next one. Here are the techniques. Here are the techniques. I'm given only 26 techniques. It doesn't mean that CBT has only 26. It has more than 100 techniques are there. But I'm just given outline the members work here. Cognitive restructuring. Generally, CBT means the first word you may hear from the therapist is that cognitive restructuring. Cognitive restructuring means restructuring your negative into positive, not positive into negative. Both are restructuring only. Here it means, unwritten rule is that when the person having negative thoughts, we have to change into positive one. It doesn't mean the thinking alone. It includes behavior, it includes emotion also. Restructuring, cognitive reframing. These are the words most frequently they will say. But when we ask them how to do that, no one will say that. So that's why I given one worksheet with you in that group, and you can able to, that's for anxiety. When you are having anxiety, how we can able to use cognitive restructuring for overcoming the anxiety. And second one is mindfulness practices. Generally, we believe that how mindfulness come into CBT. Cognitive behavior therapy emphasizes mindfulness. But at present, mindfulness is evolved as an independent and unique field, unique therapy itself. Now they are competing with CBT itself, but it is a part of CBT. And thought stopping, generally thought stopping the name, but actually no one can stop your thought. If someone say that I can able to stop the thought, that means it is a false belief. No one can stop the thought. Anybody here can say that, can you able to control your mind? Anybody is here? No one. If I say that, don't imagine a red color ball. Never ever imagine a red color ball. If I say, then it will come. We cannot be able to give it, no. But we can say that, instead of say that, we can regulate. How? Think about yellow color ball. Our brain will do that. The brain will have the capacity when you are having negative thoughts. When you say, do these things, it will do. When you say, don't do that, it will not do that. It's like a husband and wife. When you say to your wife, do these things, you will not do. Vice versa for husband also. Giving for fun example here. But generally, the parents and children, at one age, when children are listening the parents up to particular age, after the particular age, they will say, no, I will not do that. So regulate, we have to regulate. Next one is activity scheduling, is one of the behavior technique. It is adopted for cognitive therapy. Psychoeducation, very common thing. When we are aware about that, the consequences, the people will stop the particular negative problem, the negative thinking. Rehearsal. So there is, I think, when you worry, that I hope you may all aware about a chart. When you worry, will it make any change? Yes, no, yes, no, it will go. And finally, need not to worry about. That is the way it will come. That chart will also I will share with you. Psychoeducation is a very important thing. When a client comes, you have to teach them what are the consequences you will face. When they realize, oh, these are the problem, I may have it in my later stages. They may not have that particular thinking. And journaling. Journaling is very popular. And there are, I still remember some of the morons, I can say. Nothing wrong to say the word moron. The people are saying that journaling will not having any impact. There are a lot of evidences where proven that when we are doing positive journaling or gratitude journaling, it has a huge impact on our emotions, thoughts, and behavior. Huge impact. We have to practice regularly. Gratitude journaling, if you like it or not, it's like a mandatory, like taking food. The same way we can do it for gratitude journaling also. It has huge impact. Miracle questioning, what we can say, Aristotle questioning, power questioning. There are many words they are using, but on the questioning you have to ask. And thought records. Thought record means what kind of thoughts we are having. Many people we are not aware about. We think that we are having only good thoughts. Actually, when we record it, we come to know that we are having many negative thoughts. Thought record will give more insight to that what kind of thoughts we are having. It's very amazing. I will give one thought record worksheet also. Introspective exposure and exposure and response. Nightmare exposure therapy and relaxation breathing. Breathing is another component. Guided discovery, focusing, self-compassion and acceptance, role-playing, successive approximation, labeling the distress in itself as an help us to overcome, and knowing that pros and cons, setting that boundaries, managing it, listing the advantages and disadvantages, self-instructing and coaching, investigative thoughts, examining information. These were some of the techniques in CBT. So I can stop here, and we will move on to a particular problem, and we will work on that. Okay, so the theory part is over. I hope you got on some insight. And the people who join little later, I will give a recap about that what we were discussed here. CBT is a blended therapy or integrated therapy, integration of cognitive behavior components. And very popular, CBT itself has many types. Multimodal therapy, REBT, CT, CBT, and brief CBT. There are many variations also there in CBT itself. And a lot of people were contributed for different purposes. These CBT were used. And there are certain steps need to be followed. And it has principles also. These are the things we have to aware about it. Now, I'm going to share you. In a group, I will do share just a minute. And one condition is you can keep it more confidential. Do not share with anybody else. That is the only request to the members. For your learning purpose, you can use it. For learning purpose, you can use it. Do not give it to anybody else unless getting written consent from me. So, so check your WhatsApp members. Please check your WhatsApp. So you may receive the content there. I can. Have you received?
Yes, sir.
Okay.
Yes,
In
sir.
the group,
2 pages.
it is in the CBT workshop group is there.
Social relationships.
Okay. Okay.
So no explains in my behavior or the other things. Sir.
Okay.
I don't know whether it's right or not, but I was rechecking myself once again. But
Understood.
most of the times I'm sociable, and I did a normal mental state. No extreme situations.
Fine. So yeah, out of 4 components, do you found that any component you need to improvise?
Yeah, one thing is my sleep pattern. My sleep pattern, sir. That is one thing which I marked it.
Cognitive.
That's cognitive. That
Oh.
is one thing which I felt I had need to work on it.
Okay. Thank you, ma'am. Any other members? See, we are given a 4 column, 15 points in each column. And you may found that out of 4 social components, you need to be improvisation. It doesn't mean that you are having the problem. The area need to be improvised. Out of 4.
I can share, Doctor.
Yes, sir, please, sir.
Can I share?
Yeah, yes, sir, please, sir.
In the cognitive racing thoughts, one thought of some other thoughts, except when I sit on meditation, there are almost thoughtlessness, almost. But otherwise, one thought or otherwise regular thoughts are going in the cognitive.
Yeah, I'll give you.
The second is some inclusive thoughts.
Yes.
When I was thinking of something, some other thoughts steps in. These 2 are in cognitive.
Okay.
And emotional, not regularly, sometimes I get irritability.
Okay.
Somebody is expected 10 o'clock. He comes at 10:30. I get irritability.
Yeah, understand.
And I'm also very emotional sensitive. Even when I'm driving, I see somebody with a lame leg or a torn class, I feel like stopping and be of help to him, which I'm not doing it, but very sensitive I'm that. Coming to social relationships, I think I'm not very sure, but slightly I'm moving towards people pleasing. Is it necessary for me to get please everybody? I know that, and I'm working on that. But slight even that trace is there. And sometimes another one is impulsivity.
Okay.
Though I know the theory of thought and the process and emotions and behavior, sometimes I become impulsive. Then I thought, being a human being, occasionally I become impulsive is okay, but mine is not impulsive behavior. Therefore, I thought it's okay. Because again, I console myself saying nobody is perfect. I am also not perfect. Let me work on these things.
So you are more genuine in giving that input, sir.
Pardon?
You are more genuine in giving that inputs here. And really, that is a common problem we may also have. And the last one person, anyone come forward, and we will address some of the issues here. Anyone?
Come on, friends, do not hesitate.
Sir, in the behavioral thing, I find one thing, impulsivity.
So immediately you are reacting rather than responding. Okay.
Yeah.
So Father, the only thing is on mind.
I take steps without thinking the consequences.
Yes.
If I decided to go for one thing, I'll do it. We'll see to it later. What happens?
Okay.
First we'll do it. Take action.
I understand. Thank you. Thank you. Friends, I hope you got on some insights regarding that core component. I can say that the CBT criteria later they evolved as a mental status examination, and it could be used. And some other mental status examinations are very short, and it will be checked by the, for example, if you are a practitioner, if your client is there, and this form is given to the client, they can able to fill. But that form you can only kill because only keywords will be there. So when you observe, when you're interacting with them, when you're getting inputs, we can do that. But that form also it can be used. That is more reliable, and the less space will be used. In a single page, you can able to know about around 100 issues of an individual. It's like a very small thing, checklist. More or less, it's like a checklist. Okay.
Are you sharing it with us, sir?
That form, ma'am? Yeah, that will be done.
Yep.
So
will you give permission to use this to us? This is very, very interesting, actually.
Yes,
very.
The only thing is we can get a written permission on that, sir.
No, that's what I'm just asking you. Will you give us permission to use it?
Members who are attending here, it will automatically in the certificate itself, in the mail, you can able to see the worksheet shared in this training can be used by you for your learning purpose.
Thank you. Thank you so much.
Welcome. Yes.
Rutiraj, remember that you have to take his written permission.
The MAC form or another form,
his written
which can be
permission,
shared with the patient.
You will say yes, then
that's
only
what you said, no, sir?
Yes. Actually, it is an ethics. when we
Yeah, I know. That's why I'm asking you this question, sir.
yeah,
Without your permission, I should not be using this.
yeah, you are
I should
attending.
not use it actually.
Yeah,
And my
ma'am, you are attending here, and the members who are participating as an already rights to use that for learning purpose. But when you are using it for practicing purpose, you have to get a written purpose. That's all.
That's exactly what I want.
That will be done.
Thank you, sir. Thank
Okay.
you.
So now we will take one example, one issue, then how we can able to come out from that. I hope you all received that another worksheet which is shared in that WhatsApp group. Can anyone let me know what is the worksheet?
Anxiety one?
Amazing, ma'am. Amazing.
Yeah.
I do share that worksheet with you, the members who are here, and I will give a brief intro about that, how you can use that worksheet, and what are the additional supporting information you needed for filling that information. Yes. This is a worksheet you have received. Right.
Yes.
Okay. So you can
Sir,
have.
I have not received it yet.
You are not in a group.
It is in the group,
Yes.
Dr. Suresh.
So it is in the group. Before beginning
Okay.
the
Okay. Got it.
we can go to that worksheet for anxiety. This CBT worksheet is only meant for anxiety. First, we have to understand and challenge that anxiety. I'm giving one example. The same way, this template, I can ask him suffering from fever, can remove that suffering from stomach ache. So I'm suffering from headache. So you can use the word. The template is a template, you can use it for anxiety, depression, any other psychological problem, you can use it. So first thing is identify the situation. What are the environment, what are the situations trigger the person causing the anxiety? It must be more specific. Who? If there is any person, it may be husband, wife, parent, children, friends, or we have to mention the person. What kind of trigger you are getting from them? And when it is happening, where it is happening. Not all that you can say that it is happening only during the summer, it is happening only in the morning, it is happening only in the evening. So where it is happening, in house or workplace or social gathering or in a festival season. So you have to list out those triggers. That's the first step. That's the first step. And second one is after done that, here is when we have to identify these triggers are whether it is an automatic thoughts. Whether it is an automatic thought. See, so when you think about the situation, the thought will come in. You just write it. When I asking about Mother Teresa, you are saying that loving, caring, humanitarian. So these are the words here. When you think about the particular triggering situation, what kind of thoughts you are getting? You just write it. You have to force it. When you think about it, it will come. No? For example, if I think about Dinagar Rao, and I'm having that the man with a lot of wisdom and still he is curious to learn. So that thought is coming to me. Same way for when I think about someone else, Sunanda. So she's more dedicated and open to learn. So and Amrut sir, and I can say that I think when there is a learning platform, is that he will be there. So these are the thoughts I'm automatically it has come to me. So we can able to find out when there is an anxious situation, what kind of thoughts you are having. You just list out that. And then about it, you have to rate that intensity of the anxiety. 1 to 10 scale. 0 to 10. 0 means you are not having any anxiety at all. See, remember that anxiety has a mild, moderate, and severe. When 0, you are not having any anxiety, but then is a more anxious, the most anxious. And we have to rate for the particular stimulus, particular trigger. Can give the rating. And that rating is on generally, I don't know how many of you are traveling in different places. When you go in aeroplane, in a flight, you can able to see when your luggages will be given on a luggage, package, storage will be different places. When you're going in a connecting flight, I don't know how many of you are closely noticed that they're having 3 colors of tags. red color, yellow color, green color. Do you know the meaning of these 3 color tags? They attach with your package.
No.
Red
No,
color.
no idea.
So the connecting flight timing is less than half an hour. So by looking at the tag itself, the people who are take it very quickly, they will go. And same here for that. If your score is 7 and above, then red color tag, you can use it. That means that immediately addressed. Between 4 and 7, that is an yellow color. It is like a signal we are stopping emirate, so you have to get ready. And less green color, and you need not worry about it. You can lesserly, you can able to solve the problem. And in a connecting flight, if you are having these talks, and the color of the tag is on green, yellow, red. Red color means when I look at that, the employee will quickly take it and transfer it to that another flight, the connecting flight. If it is an yellow color, the lesserly will go. Green color, they will more lesserly they will take because it may be 10 hours or more than 8 hours will be there, one flight to another flight. That is the way they will do. Here also we can get a rating for the anxiety of an individual. We can go for 0 to 4, 4 to 7, and 7 and above. 4 to up to 4, you can give green color. 4 to 7, you can give yellow color. 7 and 10, you can go for red color. The red color means immediately out of stress. And once if you done that rating, the next step is we have to identify the cognitive distortion. Cognitive distortion is nothing but a cognitive error. If a person having that anxiety, what are the possible errors are here? Catastrophizing. Catastrophizing nothing but when the people are traveling in the bus, they think that the bus will get accident. The worst thing will happen. That kind of thought they are having. All or nothing thinking. They think only black and white. She will be good person or the person is not good. Very, very worst cognitive distortion. There is a gray area. A person may be good, may not be good. Sometimes good, sometimes not. So these things we have to do. In the mind reading, we may think that, okay, this person will read and understand everything. The person is doing something wrong for us. Mind reading, no one can do that unless if they are having more experience and effort they made to understand that, they can able to predict. They can say hypothesis. Prediction we can able to make, not a finding. And finally, overgeneralization. When we say it is happened with one time, for example, if I have a good experience with one person, I cannot assume that the same kind of experience I will have with the same person next time. No. If I had a bad experience with one person, very next time we will be very, very careful and we never have any kind of initiative. So that's called overgeneralization. So we can understand that what kind of cognitive distortions you are having. As I said, I promise that I'm going to give you a common automatic negative thoughts. How you can change that automatic negative thoughts into positive thought? A chart will give you. You can use it. That is, I can say it is a Bible for your CBT therapy. It is the Bible in Christianity. We can say Bible is a holy book. In the Bhagavad Gita, in Islam, there is a Quran. For CBT practitioners, I can say that the chart I'm going to share with you, that's your Bible. Okay, I'll move on to the next one. Once you identify that what kind of cognitive distortion you are having, you have to list out whether you are having. If it is so, what is that? Where you can get these things. I'm going to give a chart, am I right? In that chart, you can able to take it and you can able to fill here. And step 5, the next one is you have to challenge and reframe that the negative distortions are the inappropriate thoughts we are having. That automatically comes in our thought that need to be challenged. So one is the thought based on the fact or assumption. If it is an fact, you have to accept it. If it is an assumption, for example, fact is that you are not having milk in your home. You cannot able to prepare. It is a fact. It is a fact. Hypothesis, assumption is that you are going to your friend's house, you assume that there may be a milk. They may have the milk. Okay. But when you go there, it may not be there. assumption. These are the things when you are not sure about it. When you are traveling, the bus will get accident. It's an assumption. It's not a fact. What is fact? When 1,000 buses are going, there are 0.01% chances are that the accident may happen. That is fact. Generally, assumptions are the root cause for many of our problems. We assume that the person will be not loyal. This person is worthy, not worthy. What is the evidence? And the next one is you have to check what is the evidence for the thought you are having. Saying that, okay, do you know that person? That person is very bad. When you hear this statement from someone is near to you, and you have to verify. If there is any evidence is there, you can ask them evidence, give me the evidence. If I say this pen is I got it from Mahatma Gandhi. I'm saying the statement. Will you accept that? There is no evidence at all, because he was no more in 1948. That is practically not possible. I can born in 1948. So the evidence, you have to check. When you are having a thought, you verify the thought, what we can say. Evidence verifications. And we have to understand that, am I jumping into conclusion or I'm predicting the future? When we go to that fortune tellers, Rasi Palan, what we can say, horoscope, and they will do that, jumping into conclusion. And I can give one example. When you talk about your partner, when you talk about your friend, I know about you, that is jumping into conclusion. I know that person, jumping into conclusion. It is an error, actually. We believe that we know everyone. No, we are not aware about anything. And personality is not dynamic. One more thing. The person may be very good, and when you are having a warm relationship with the person will change one point of time. Because personality is dynamic. You are not supposed to jumping into conclusion with a particular one. And what would I say to friend who had this thought? When we have to ask yourself, generally, when a friend having the problem, we have a lot of solution to the problem of our friend. When we are having, we may not having any idea. So if suppose your friend is having that particular thought, what kind of suggestion you will give? Think about it, and you can challenge that. So how you can challenge or reframe that? What we can say, it's nothing but a cognitive restructuring, challenging the thought, negative thoughts, reframing the negative thoughts. So that word you are doing it here. You do that. Next one is when you've done that, generate alternative thoughts. The balanced thought or neutral thoughts or positive thoughts. And one more thing, it must be realistic, based on reality. Some people will think that their ability is an 80, they can able to score 50 marks out of 100. Okay, if they think that they can score only 40, it is a negative thoughts. You cannot think that I will score 100 out of 100. Practically not possible. You can score only 50. You have to think only that reality. Here, cognitive therapy, rationalization must be realistic rationalization, not toxic rationalization. Unrealistic rationalization is inappropriate. Many people, when you say, you must have on positive thinking. Or if I think that I will become a millionaire next day, I will become a no. That's not a realistic one. The people, morons, are thinking that when you are having a positive thought, you can able to change. Realistic positive thoughts. When you can able to jump for 2 meters, and you have to think that one. You cannot think that I can jump 20 meters. And they are confusing that 20 meters with 2 meters. What we can able to do that we have to think. That is a positive thought. Reality, the evidence. And alternative thoughts we have to list out what I can able to make it. I can be happy. I can able to come out realistically. How actually can able to come out? Accept it as it is. For next week, for example, if I am preparing 10 units, for the first week I can prepare 1 unit. Second week I can prepare the second unit. That's the way we have to move on that. And once if you've done these things, alternative thoughts are, I'm going to give a chart where you can able to have a common automatic negative thoughts You're having automatic positive thoughts. So you have to re-rate your anxiety once after done these everything and re-rate your anxiety out of 10. If it is there earlier it was 8, if it has come to 3, and you have to feel happy that yes, there is a positive progress in your overcoming your anxiety. And finally, plan an action step. What are the steps you can take? If again we are not resolved, okay, if you are 3, how you can come to 0? Make an action step and reflect on yourself. Now you look at your thought pattern, how you can challenge your anxiety. So it is a lovely worksheets. This is a pattern, and I'm given the only outline for you. You can make a roadmap. You can use your creativity and use these template into as you like it. Okay, I can stop here. I hope the inputs are very useful for the members over here, and the interactions for another few minutes. If you have any questions, any suggestions, any inputs, you are welcome. Yes. Am I with you all?
Sir,
Yes, sir.
please
Thank
do
you very
share
much.
some more sheets like this that we can use with
For
your
you-
due permission.
Yeah, this training is meant for only 2 worksheets, sir. Actually, I given 4 worksheets.
Okay.
So next we will have it few more sessions.
Okay, sir.
Sir, can we have a separate session for REBT?
Yes, sir. We will plan it. Definitely, we'll do that.
That is something I feel that it is less explored.
Yeah,
CBT
true.
is more commonly practiced, but REBT is
Well,
still is also equally effective.
yes, in CBT itself, there are many components still. We just tip of the iceberg we explored. See, when we look at that, a specific problem, common problem, we can able to come up.
Sir, how it is different than CBT? REBT is different than CBT.
Most of the components are similar, sir. Only thing is, they able to focus on emotion when compared to cognition alone. In CBT, cognition and behavior alone, predominantly more focused in techniques. But the emotional techniques were much focused in REBT. Emotion is the first.
Okay.
So can we have more sessions on details of the techniques of CBT?
Yeah, CBT itself, as I said, it is I identified nearly, based on my research, I identified nearly 65 plus. 65 plus techniques are there in CBT itself.
So can we go for detail
Yeah,
for that
one by
detail?
one we can able to go. For example, we have done a cognitive restructuring. That itself, there is a separate slides are there.
Okay.
We'll start one by one technique in coming days. Probably once in a month or twice in a month, we can able to have it.
Okay, sir. Sure.
Sir,
Yes.
if a person's emotions affect his behavior more than his thought process, does it mean that person has some problem?
Definitely, ma'am. See, when there is a, if it is an socially accepted level of behavior is influenced, there is no problem at all. If my emotions are having impact on behavior, that behavior is not accepted by the society, or if it is not confined to the social norms, then definitely I have to accept that I'm having the problem.
Okay, thank you, sir.
Yeah. See, there is one more question. Dr.
Please.
Vedantam. What type of healthcare professions will be experienced in eclectic therapy? Can he help arrive at this complete? Yes, eclectic therapies are most effective. Why eclectic therapies are most effective? Sometimes we may not be able to make a decision. For example, humanistic therapy that mostly rely on that. If the client has a potential, sometimes they may not have. It is we have to come and help them. There is when we are memorizing something, the person forgot something, we have to give a kickstart.
What
So,
professional, sir? Psychotherapist or what kind of professional?
eclectic therapies and psychotherapists only. Counselors and psychotherapists they can use. Actually, I hope you may, there are in therapy itself, directive, non-directive and eclectic. Directive is the counselor will be dominant. The client must follow whatever the words are given by the counselor. He must follow, the client must follow directive counseling. In non-directive counseling, the client make a decision, the counselor is on facilitator, the therapist is on facilitator. Eclectic is on, sometimes the dominant role will be taken by the counselor, sometimes the client will take in care. It's a mutual. So eclectic is the most effective method. I hope there are few persons who made. Williamson is a directive counseling approach founder. Carl Roger is a non-directive, and F.C. Thorne is an eclectic approach. But nowadays, if you ask me eclectic or multimodal, multimodal is the most effective. That is a multimodalism. Some technique from gestalt therapy, some technique from behavior therapy, some technique from humanistic, they will take it and they will use it for helping the person to overcome the problem. That we can call as an eclectic nowadays.
Thank you, sir. Sir, one more doubt.
Yes.
Is there a difference between psychoanalyst? Is there anyone separately called psychoanalyst, or the therapist will do that?
No, when you are having studied psychotherapy, you can say psychoanalyst. Psychoanalysts are one thing. They mainly focus on conscious, unconscious, subconscious mind.
Is there any profession like he's a psychoanalyst?
Yeah, yes, psychoanalytic people are, for example, Adlerian therapy. There are 2 years master degree programs there.
Okay.
Adlerian therapy itself. So they can claim that Adlerian therapist, psychoanalytic therapist. There are programs, but when we are taking more courses on that, and we can also claim that.
Thank you, sir.
Sir, you're given all the anxiety worksheet and everything is fine. You any suggestions and tips to how to overcome
Suggestion to overcome?
to anxiety? Because after doing all this analysis and everything, finally we need to suggest, and maybe you have to come out with
that
something.
itself will help them to overcome when they are the trigger, and here like a prevention.
Okay.
So when I am aware about that, the particular person who come into my home, I feel more uncomfortable. So I have to prepare my mind. Okay, that person is not there, or else I have to make the person not to come to my house. So when we make it, the problem may not come. In this worksheet, focus on those components alone. For example, you are asking about if there is any therapeutic techniques other than there are many techniques are there. Almost all the relaxation techniques are JPMR, mindfulness breathing, mindful color breathing. There are many techniques are there.
Okay. And there are today we learned 2 things. One is that ANT, that is automatic negative thoughts, and the second one is anxiety, identifying anxiety. Is it right, sir? That's I just wanted to check myself. I missed it.
Yes, correct.
These 2. Okay. Thank you, sir. Thank you very much.
Welcome.
Even though we know beta, I would say CBT, but say you have given us a new angle of it.
Yeah, definitely.
New perspective.
That's why even when I know that when someone is taking a session, I used to attend that because I want to know their perspective also. So when we have some understanding, other perspective will help us to refine, and we will do better in our practice. The time is up. Sunanda?
Yes, sir. I shared feedback form in chat box for e-certificate. They have to fill, sir. Please mention that also.
Friend, those who are joined here, you can able to fill your feedback to get your certificate.
The written permission also for using it for purpose. I think that also we need to. Yes.
Yeah, friends, you can share how the session was, and we can request some more sessions on different techniques and therapies.
And of course, the session was very informative and very useful to us. It gives very clear things about the topic. But as I requested earlier also, we need some more sessions regarding this CBT and about the techniques also in details.
Sure.
Monthly one session, sir.
Yeah, we'll do that.
Monthly one session.
Sunanda, I didn't get that link for feedback.
It's in chat box, sir.
For timing, I was disconnected, so it's not there. Can you send in
Okay.
the group, ma'am?
Yeah,
This group, this 21 persons group.
yeah. Sure, sir. I will share.
Thank you.
Yeah, friends, others can share their experience.
Yeah, they have done already. I think we can conclude. Timing.
Okay, sir. Okay. Yeah, Dinakara, sir. Please give VOT.
As
Friends,
usual, sir.
friends, no, somehow my mind got disconnected. I hope my voice is clear to you.
Yes,
Yes.
sir.
Yes,
Yes,
yes.
Is my
please.
voice clear?
Yes,
Yes.
sir.
Yes, sir. Yes, sir.
But
Very clear.
friends, I was very happy to attend the session in the sense I was not very sure because my wife was not fully well. But because Dr. Suresh is taking the session, I said, how can I miss it? He's, I don't know how many people remember, he's declared as the psychologist of this year. And he is the mentor, friend, philosopher, and guide for the DPMP group. Sunanda Ravi is motivated by him. At my age of 78, 79, I am also motivated by him. One of a wonderful session covering all the aspects of holistic way he has covered different aspects of sort of psychotherapy, psychoanalysis in counseling. He has not covered a single topic. Though he was talking about CBT, he has given an overview of all the aspects of psychology, psychotherapy, and psychoanalysis. On behalf of all the participants, on behalf of DPMP, I'm highly thankful to Dr. Suresh for taking this session. And we are going to have a session at least once in a month. Subject is availability. Thank you very much, friends, for attending the session. Once again, that's up to you, Dr. Suresh. Wonderful session. All of you give.
Thank you.
Clap.
Thank you so much, sir. I'm really dedicated this session to you.
Thank
I hope I had a VOT from you itself. Thank you so much.
Thank you.
Thank you all. Thank you, everyone. Thank you
Yeah.
all.
Thank you, friends. Thank you,
Thank you,
sir.
sir.
Everyone.
Yeah.
Thank you, sir. Thank you, Sunita, for
Thank
having
you. Thank you.
Thank you.